that we had inadvertently put anybody else's health in jeopardy. Happily for us, we did not. But I've heard many personal stories from individuals who have shared with me their reaction within the community. Every statistic, every hospital admission, every workplace outbreak impacts people's daily lives. For many people, the impact is devastating on their personal level and often is accompanied with economic hardship. My sincere condolences go out to each and every one who has been so adversely affected in this pandemic. I want to sincerely thank everyone from across the region and beyond who have sent well wishes while I was recovering. Today, the province is launching a social media campaign called Stay Home, Stay Safe, Save Lives. It's hashtag Stay Home ON for Ontario. I hope that you will participate in it and spread the word. This morning, we, sorry, we will have our weekly update from our Medical Officer of Health, Dr. Wang, as well as a update on the vaccine rollout by Deputy Hilton. And I'm really pleased today that we have been joined by Tony LaMantia, Executive Director of Economic Development, Waterloo Region. My computer is not cooperating. Sorry, guys. Bear with me 1 minute. That's what happens when you take a week off, I guess, eh? Before we hear from our guests, I'd like to remind everyone that Council unanimously approved our 2021 regional budget this week. This was a thoughtful, deliberate, and purpose-built plan that aims to bring better quality of life to the 630,000 residents now and into the future. This budget demonstrates Council is committed to investing in our diverse and growing community while helping ensure the community is well positioned to emerge from the pandemic. We provide critical services to every resident every day. Things like transit, paramedic services, waste management, safe drinking water, and major construction projects. These services will continue, all the while responding to the urgent and growing need for affordable housing, the need to build an inclusive region through investment in our marginalized communities. Our plan and budget recognizes the need to support our local economy, and that's why we're providing targeted supports to local businesses. And I look forward to hearing more from Tony this morning on supports for local businesses that are available. Must also recognize the collaborative effort of council and staff to bring this transformational plan forward that will lift our community beyond COVID-19. We will continue to prioritize the vision for Waterloo Region, which is created with significant input from the residents. Today's enforcement update is from January the 14th to the 20th and includes actions from our local enforcement partners. There have been 12 enforcement actions since the last media update, 9 for the reporting period January 14th to 20th. 3 charges were from the previous reporting period but were not reported at the time of that update. GRT Security issued 1 ticket for failure to wear face covering, a total payable of a ticket of $240. City of Kitchener bylaw issued 2 tickets at the same private residence. Tenants were hosting a gathering. Both the tenants were charged. Total payable was $880 for each ticket. The City of Waterloo bylaw issued 3 tickets at 3 separate private residences for gatherings. Total payable was $880 per ticket. The City of Cambridge bylaw issued 5 tickets. 4 were issued for 4 separate private residence gatherings, a total payable of $880 per ticket. One was issued at a park for 4 individuals in a vehicle watching sports on a cell phone. 3 of them left the area. The driver was charged under the EMPCA stay-at-home order. Total payable was $880. North Dumfries bylaw issued 1 ticket for a violation of the EMCPA stay-at-home order. Individual was having a party at an Airbnb and the total payable amount was $880. I would now welcome Dr. Wang to give us our public health update. Welcome, Dr. Wang.
Thank you, Chair Redman, and it's great to have you back. So I'll start with our overall trends. So we are starting to see new cases slow and move in the right direction. But our situation remains serious, and the second wave has impacted our community significantly. Our incidence rate has decreased. It is now at approximately 127 cases per 100,000 per week. We are currently managing 857 active cases and 38 outbreaks. While these numbers are down from our record highs last week, they are still much higher than what we have previously experienced in the spring or early fall. Taking into account interim data, our latest percent positivity has also begun to decrease and is currently at 5.5%. Our latest reproductive rate is at 0.8, so below 1. Hospitalizations and ICU admissions in our community are up. This is not unexpected. Hospitalizations, people requiring ICU care, and sadly deaths are lagging indicators. They are expected to continue to increase in the weeks following high case rates. Regarding the enhanced measures the province has put in place, we are beginning to see the impact of our individual actions and the enhanced provincial measures are having to bring the spread of COVID-19 under control. I'd like to be clear that while we are seeing improvement, our numbers are still quite high. COVID-19 continues to circulate widely in our community, and we must continue our commitment to public health measures to keep moving in the right direction. Ontario's enhanced public health measures are anticipated to be in place until at least February 11th, with the possibility of extension as needed. Evaluation of the measures will be done at the provincial level, as will the decision to lift or extend any measures. We remain supportive of Ontario's enhanced measures and the need for people to reduce activities, staying home as much as possible and only leaving for essential purposes, such as for work, food, medical appointments, or physical activity. Due to questions that we've had on this topic, I'd like to mention that drive-in religious services, rites, or ceremonies are permitted in Ontario under current provincial regulations, as long as people in attendance remain inside their vehicle, except when necessary to use a washroom, or as may be necessary for health and safety, and vehicles are at least 2 meters apart. In-person outdoor gathering limits do not apply to drive-in religious services. Limiting our close contacts is one of the most important actions we can each take to help slow the spread of COVID-19. One of the challenges with COVID-19 is that the infectious period, when you can spread it to others, can begin before you develop symptoms. This means you can unknowingly spread it to someone you have close contact with, often to the people you care about the most. When we reduce our close contacts and limit our essential trips, we reduce the opportunity for COVID-19 to spread. By taking these actions, we work to protect one another. A little bit about the dashboard update that occurred earlier this week. So earlier this week, we made some updates to the Outbreak tab on our dashboard to provide a clearer summary of active outbreaks in our community by setting. All outbreaks are now reported in one table organized by setting. You can filter by setting, or you can also filter outbreaks by active outbreaks only, active outbreaks and declared over in the last 7 days, and all outbreaks active and over. There are also 2 new graphs. These changes allow dashboard users to have a greater understanding of how outbreaks are distributed across our community. And as I mentioned before, outbreaks are a reflection of what we see in our community. As community spread increases, we expect to see more cases in various settings and more outbreaks in these settings being declared. In closing, we are starting to see some of our trends improve, but there is still much to be done. We are not on the other side of the second wave yet. Our continued improvement depends on the actions of everyone in our community. The measures are not easy, and I appreciate this is a period of significant strain and challenge for many. But Waterloo Region is a caring and resilient community, and I encourage us to support one another. Stay connected while apart. I also encourage us to look for opportunities to support our mental health by staying active. Many of our municipal partners are offering recreational programming that can be done at home or safely outside. And if you are struggling, local support is available for you. I am grateful to our community for our continued efforts, and we are starting to see how our everyday actions can make a difference. By working together, we can slow the spread of COVID-19 in our community. Thank you.
Thank you very much, Dr. Wang. We'll now hear from Deputy Hilton on the Vaccine Task Force update. Welcome, Shirley.
Good morning, and thank you, Chair Redman. Good morning, everyone. With the pause of the Pfizer vaccine distribution to Canada, this has had an impact on Waterloo Region. We did receive our allocated supply this week, which allowed us to continue with our mobile teams in the long-term care homes and the high-risk retirement homes. However, the decision was made to pause the Grand River Hospital clinic in order to continue with the prioritization within the long-term care homes and the retirement homes. I'm hoping and I'm hopeful that at the end of the week we will have great news to provide, but we are on track as it relates to having all residents within our long-term care home and high-risk retirement homes with their first dose of the vaccine. We will not be receiving a second dose or a second allocation next week. However, we'll be able to open the Grand River Clinic to resume with second doses, and we'll use the supply that we do have to continue with that particular program. And again, the supply after next week is very uncertain, and we will be making our plans week by week to be able to continue with the vaccination program. To date, if we look back, we are 1 month into the vaccination program. We have vaccinated over 1,300 people with a split amongst over 4,000 administered to long-term care and retirement home healthcare workers and essential workers and caregivers. Over 4,000 doses have been administered to hospital healthcare workers and over 4,000 to long-term care residents and high-risk retirement home residents as well. Unfortunately, with the pause with the Grand River Hospital Clinic, I mean, it's unfortunate, but we've had an opportunity to shift so that we can prioritize our, sorry if I had said 1,300, it's 13,000. Thank you, Tony, for that. But we've been able to continue with our mobile teams. What I would like to do right now is to share with you a placemat that I've already shared previously in other forums. Before I share it, I will tell you that one of the placemats is the provincial guidance that's guiding our strategy, which assists us with our prioritization. And we've developed a placemat in a local format as well. There are the data on the placemat is not accurate because this was created prior to the pause in Pfizer and the fact that we do not have Moderna here in our region as well. The reason I'm sharing the placemat for everyone is to provide a pictorial of what the plan looks like in the region of Waterloo, and then I'll provide a little bit of context as it relates to how we envision this rolling out for the region as well. But again, the numbers are inaccurate, and I ask that you just bear with us because of that reason. The provincial, this is the provincial placemat. As described in the past, we are looking at a phase 3 approach to the delivery of vaccine. This is all dependent and only looking at the Pfizer and Moderna vaccines. And again, I will reiterate, we do not have Moderna in Waterloo region. We've only been vaccinating with Pfizer. The other caveat in all of this that I will speak about is the unknown in terms of supply and the stability in supply, and also the unknown in other vaccines that might become available as we move later into the phases when I speak of the spring. So the priority populations, as I've mentioned, have already been developed by the province, and how the region is responding to that is developing a sequencing within those priority populations. I will move to what this looks like locally. And the sequencing will then allow for what are the priority already set, what is the sequence in terms of how we deliver to the priority population, and then what is the best method to deliver to the priority populations. So we've talked about in the past that we will be looking at fixed sites. We have our Grand River Hospital Clinic, and we will be looking at 2 additional sites at this point to assist with the mass vaccination plan, one being in the north and one being closer to the south, so that we have an opportunity to reach a greater population easily. Also with that, we're looking at our mobile teams. So where is it best to have our mobile teams attend to particular populations that might not be able to get to the fixed vaccination sites? In addition to that, we are also looking at infrastructures that are currently in place. And so working with our Ontario health teams, looking with our primary care and our pharmacies to be able to start delivering and administering vaccines within those areas as well. So it's a complete wraparound vaccine distribution plan to not only look at the fixed sites, but it's also to look at how do we hit other populations that might not be able to attend. So with the mobile teams, in addition to utilizing a pharmacy and primary care. I will leave that up for just one more moment. I know there will be questions, and I do again want to reiterate that this is a moving plan. The phase 1 doesn't have, as much as we have the dates there and doses allocated to the dates, this is a moving plan. So the beginning of phase 1 and the beginning of phase 2 are not fixed, and it will move based on what the eligibility is of vaccine. One of the things I would like to close with is that just with a reminder that although a vaccine is an important step toward recovery, safe distribution to the general public will take time. Along with your patients, we ask that the community continue to follow public health guidelines. There is an incredible team that's working behind the scenes, and what I will say is that the team is preparing for an vaccine to come hopefully in March. We've been told that the vaccine will be making up for the shortage that we are seeing in February. General Hillier has publicly said that he's anticipating that public health units will be delivering or administering 10,000 vaccines in a day, and that is how we are planning if that should occur. Thank you very much.
Thank you, Deputy Hilton, for all your hard work and leading such a integrated community team. It's very impressive to be part of it. Next, I'd like to introduce Tony LaMantia. Tony is the president and the CEO of Waterloo Region Economic Development Corporation, and Tony's going to discuss local businesses, supports, and economic recovery. Welcome, Tony, and the floor is yours.
Thanks, Karen, and good morning, everyone. So about 10 months ago, we launched a construct that we call the Business and Economic Support Team of Waterloo Region, or BEST Waterloo Region. And I chair the leadership group, which includes the Kitchener-Waterloo Chamber of Commerce, the Cambridge Chamber of Commerce, and Communitech, but there are also another 84 individuals and stakeholders from the region of Waterloo, the Tri-Cities, the townships, the BIAs, the tourism organizations, the workforce group. So basically a very large mobilization to, initially it was about PPE mobilization and business supports, but 10 months later, we've been able to stand up a number of programs federally, provincially, and even municipally that support businesses in areas like, really cash flow support. So think about wage subsidy, loan programs through SEBA, rent, small business supports, tax deferrals, utility. And the focus over the last couple of months, and this is important, really has been to support small retail, hospitality, tourism sectors, because they were hit first, hit hardest, and will likely be the last to recover as we look for some blue sky out of this the current pandemic. And a number of new programs I will bring to your attention, including the Ontario Small Business Support Grant. And there are a number of community improvement programs that are being considered at the city level. So specifically, City of Waterloo is kicking around a $1 million support program, which is stackable with federal and provincial programs for things like physical distancing, dividers, business adaptation, improved ventilation, outdoor business improvements, patios, and tech expansion. And so there are a menu of kind of many different programs. And in addition to COVID-19 business support resource pages, which all of our websites, so Waterloo EDC, the Chambers, Communitech, and others, they already have links to that. We've also launched a twice weekly Ask an Expert initiative. So every Tuesday and Thursday at 2 o'clock, there's an opportunity for small businesses to ask an expert about eligibility questions, accounting concerns they might have. And trust me, there are a number of questions that have yet to be resolved. And as much as being able to stand this up has been, kind of one of the most gratifying things I've ever been a part of, we're still very much in the thick of a few difficult months. So the more supports we can throw to small businesses, the better. Always hearing about different anecdotes. I heard this morning about a laundromat that was having challenges with the Ontario Small Business Support Program because they were deemed essential and didn't have to close down. But, and they have less than 80 employees. But the reality is, I used to take 6 to 8 shirts to the laundry, plus some pants and a couple of jackets once a week. And I'm now taking 3 or 4 shirts once a month, right? And so, there are a range of things that don't fit with these programs that require continued advocacy to government, but there's just a lot of stuff going on, and half the battle is to promote awareness. And so I'm very happy to engage with stakeholders and the media to help promote awareness of these initiatives, which are going to be really important for those hardest hit companies to get through the next couple of months. And so I will just leave it there, and thank you for the opportunity to provide an update.
Thank you so much, Tony. You have provided amazing leadership within the business community. And I remember the sort of tagline when you started Best WR was "There's no wrong door." And I think sort of acting as that path finder for a business has been really important. Damon, do you have any questions?
Yeah, I just have one for now. For Deputy Hilton, I was wondering how many of the 13,000 individuals who have been vaccinated, is that their first or second vaccination, if you could break those down?
Thanks, Damon. As I reported last week, we did start our second dose clinic at Grand River. I believe it was only on Thursday before we had to make the decision to shut the Grand River clinic down from Friday to, well, now to the 24th, at least for now. I believe, and again, it's a ballpark figure. I believe we've had about 300 doses. It's a give or take. I'm approximating here, who have received their second dose, but that was last week.
Okay, thank you. Nicole, do you have a question?
Hi, good morning. This is a question for Dr. Wang, and it's about the COVID variant. We haven't heard of any cases here yet, but if and when it arrives, how would you say it would impact the course of the second wave here in Waterloo region? And if you were able to ask questions to, I guess, whomever the most trusted expert is on the new variants, what would you like to know about this new variant?
Dr. Wang?
Thanks for the question, Nicole. So what we know is, Ontario has detected new variants, a small number of them so far, but they have detected them in Ontario. And I would not be surprised if in the future, Public Health Ontario, which is a separate entity from local public health, it's that provincial expert agency, who are doing the monitoring for these variants. I would not be surprised if they tell us anytime from now going forward that they have detected a variant or variants here in Waterloo region. It means that spread can occur faster, and that's really what it means. And it doesn't mean that we really need to do anything different. The measures that are effective against COVID-19, including for its variants, are the same. The staying apart, the minimizing social interactions, etc. What it can mean, though, is that the spread of the virus can occur much more readily, and therefore our case counts can rise, our outbreaks can be bigger and things like that. But it's the same measures that we've been using to date for COVID that we need to use in our region, regardless of when the variant is detected here.
Nicole, do you have a supplemental?
This question is more for Deputy Hilton. We're hearing, in other regions, and I guess more in the United States, about cases of doses of the vaccine being wasted or thrown out. Obviously people are wondering, is that happening here? And what are you guys doing to ensure that it doesn't happen?
Thanks, Nicole. I appreciate the question. I can assure you that there is no waste. Vicki Murray, who is the Director of Pharmacy, overseeing the clinic at Grand River Hospital, is utilizing pharmacy technicians to draw the doses from the vials, and there has been no waste within the clinics at all. everything that we do have, we are using. So absolutely no waste. Dr. Wang, I'm not sure if you wanted to add.
Yeah, for the mobile clinics, I can confirm that as well. Recognizing that we cannot expect perfection, it doesn't mean there won't be 1 or 2 doses like wasted in the future, but we have been very careful both at the Grand River Hospital Clinic and with the mobile clinics, and to date there have been no wasted doses, and that is the intent to minimize to the extent humanly possible any wastage, and so far, staff have been doing a great job on that.
It truly is a good news story, Nicole. Thank you for the question. And just so everybody's probably aware, there's some heavy duty construction going on in the building that Deputy Hilton happens to be in. That's not her stomach growling. That's actually jackhammering, I think, of cement. Tim, do you have a question?
Yeah, just to go off of Nicole's question about the COVID variant, I was just wondering about more clarity about how a COVID variant can mutate, because we've heard about the mutation. I just wanted to make sure how it happens.
Yeah, thanks for the question, Tim. Actually, it happens all the time with viruses. So what we're seeing now with COVID-19 variants is actually what has always happened with viruses. They can mutate. And so once they mutate, you have to be on top of, okay, so what does this mutation mean in terms of spread, in terms of severity, in terms of whether or not the vaccines we have available will be effective. So what we know to date is it does increase spread. The variants of concern, right, from that we've heard about, it doesn't appear to increase severity, but of course, if more people have it, because it spreads faster, then there's more people that are going to be ill. But in and of itself, at this point in time, based on the data we have, it does not appear to increase severity, and it does not appear to, or rather, it does not appear that the vaccines that we have available would not be effective against them. So it's really, this is a natural phenomenon that occurs with viruses. They can mutate. And so based on the information we have at this time, we know that the impact of that is it can spread faster. And so we just have to actually be even more diligent with our individual actions as much as we can. Recognizing, right, we can't always prevent it, but we can minimize the potential for spread amongst ourselves by employing those public health measures. Thanks.
Tim, do you have a supplemental?
Yeah, my next question is for Deputy Hilton. You said last week about the fact that sometimes you and your team don't know how many doses you're going to get until the day before. I was just wondering about how you feel and your team feels about that. Are there any frustrations? Because like you said, the goal is trying to get as many people vaccinated as you possibly can.
Thanks, Tim, and please, I apologize for the noise in the background. You can only imagine what it sounds like here. So in terms of, first I have to say, we have to be pretty excited that we do have the vaccine, and that the vaccine has been made available, that being Pfizer and Moderna. We could concentrate on the negative associated to the pause and associated to, there's been a lot of variables, not knowing how Canada, how that's being distributed, and then provincially how that's being distributed as well. There are some public health units that haven't received the vaccine. So we do have a great team that are prepared and want to vaccinate and vaccinate quickly, because as we've all said before, this seems to be the light at the end of the tunnel. We have to look at what the positive is. We started a program. Yes, is it frustrating that we've had to pause, and we're we're hopeful that the pause is short and that pause will, as General Hillier says, it's a short pause, but it'll make up for it in March. And so, this is where the teams are preparing so that we can, again, be on track with the vaccination plan. And you're absolutely right. The mission truly is vaccine in arms. So as much as it's discouraging, I think the teams are just so very excited to know that we do have the vaccine in our region, and hopeful that we will continue with our allocation in the near future.
Dr. Wang, did you want to add something to that?
Yeah, just real quick, Deputy Hilton's done a great job, but I think the fact that we only learn, say, the day before, is a reflection of the efforts at the provincial level and at the federal level as well to get us the vaccine as soon as they can. So it's very just in time. I don't, it's not, I think anyone's, it's not because anyone has been tardy in getting us the information. It's because they've been trying to get us information as soon as they can, and then deliver as soon as they can. So the information and the delivery can be really close together. So I just want to reiterate, yes, we have been one of the regions in the province that has received vaccine, and there are a number that haven't. And so that's something I think to just be grateful for. In addition, when there's that very tight timeline between information being received and having to execute on it, it requires a lot of scenario planning, contingency planning, and there's a lot of work behind the scenes of staff and of the various people working on this to really be as efficient as possible with this information to execute on it. And I just wanted to provide a shout out to that, because it's really, really hard to plan when you have information that's very just in time. And I think our teams have been doing a fabulous job with that. I just wanted to mention that. Thanks.
Thank you, Dr. Wang. Joanna, do you have a question?
Yeah, a follow-up question about vaccinations. I don't know for Deputy Hilton or Dr. Wang, but can you be confident that people will receive their second doses on time given the supply issues?
I will start, and perhaps Dr. Wang can jump in as well. I mean, the confidence really is on the stability of the supply, but we are prepared, as I said earlier, that right now we know we have supply to continue on the 24th with second doses, with the caveat that we're hopeful to get additional supply. I'm not sure when we might receive that, but through Pfizer indicating that there is at least that 42-day window between first dose and second dose, we are hopeful. I can't confirm and be confident, because obviously it becomes the supply issue. But what I do know and confident is that we are able to begin second doses again on the 24th.
Dr. Wang, would you like to add anything?
Just quickly, that part of the contingency planning we've been trying to do as best as we can locally is, to take into account that there potentially may be some further reductions, and therefore, we may need to potentially move out the second dose timing for certain people. But what we're planning to do, even though there could be some movement that way, is to do as much as we can, within within the timeframes that they've originally been given, if we can, and if not, at least within the timeframes that have been recommended by the National Immunization National Advisory Committee on Immunization. So just to be clear, even if someone's second dose, say, was planned on day 21, but they received it on day 28, that's a delay for them, but it's still within the recommended timelines. Or for some other people, if it's delayed up to 42 days, it's delayed, but it's still within the recommended timelines.
Joanna, do you have a supplemental?
Yeah, a question for you, Chair Redman, and it's nice to have you back.
Thank you.
Just given all the tickets that you were talking about in the enforcement update, do you feel like everyone is doing their best to follow the stay-at-home orders, or would you like to see more people sticking to that?
Well, I think the fact that the province has asked for that social media campaign to be launched today is a recognition that community spread is still an issue. But having said that, Joanna, the philosophy that we're using locally is still, as Chief Larkin would say, the 4 E's: to educate, explain, engage, and as a last resort, enforce. So I would say that to you that the vast majority of people in our community are continuing to adhere to those public health guidelines, taking seriously that they're only going out for essential trips, which is work, medical appointments, groceries, those kinds of things. So it's disappointing when you see people just ignoring public health guidelines, which is why enforcement will continue to be one of the tools in our kit. But there is no doubt that when people complain or when there are issues that arise, we will enforce. But again, most people are trying to adhere to the guidelines. Irene, do you have a question?
Yes, I have 2 questions. The first one is for you, Karen. The ticket that was issued in North Dumfries, can you tell me, was it an AIR, A-I-R, B&B, or was it an A-Y-R, bed and breakfast? Do you know?
It was an AIR B&B.
Okay, that's the first question. And the ticket that was given, would it be given to the property owner or to the person renting the property?
My understanding, it was given to the individual who was having the party. So it wasn't given to the property owner, but the person who actually was having the party that was in contravention of the stay-at-home order.
Okay, that's great. I do have another question.
You can slide it in.
Okay, thank you. Tony, it's for you. And my question is, will there be advertising for all the programs that you're talking about for small businesses?
Yeah, I mean, there's a lot of social media advertising. All of the websites are promoting them. Did you have any specific ads in mind? Because all of the BIAs, the City Economic Development Partners, so the 3 cities, the region, we're all supporting them. But if you're talking about a specific advertising budget, we're just kind of using our own resources to promote it. So that's the short answer.
Okay, so I guess it would be no, there will be no advertising in the newspaper for the programs.
Yeah, each of the organizations have business support programs, but if advertising in the newspaper is an effective way, then I'm sure that's something that we will discuss on Monday. All right.
That's great. And if you have any questions, contact us. As you know, we're a small independent business and we rely on those advertising dollars. So thank you.
I hear you. Okay.
Thank you.
Okay, Kate, do you have a question?
Yes, and my apologies. My son's in a Google Meet right beside me. We learned that there are new cases at Tent City in Kitchener, and I'm wondering if there's an update, whether Dr. Wang could provide it, or if maybe even Bruce could talk about what's being done in terms of helping people who are living on the streets or who are homeless, and what we've been seeing in local shelters.
Who would like to take that? Dr. Wang or Bruce? Bruce?
Yeah, I can start. The one thing that I really love about this region is the collaboration that's existed before the pandemic. So the work of various partners now under Ontario Health Teams, like KW4 and Cambridge North Dumfries, the Inner City Alliance, which brings together so many partners. So whether that's House of Friendship or the Working Center, our team in social services, our municipal partners, and so on. So thankfully, we have had really good support for those in need, and in particular those living in shelters. I'll let Dr. Wang speak to a recent case there. We also are, and I just got off a call with the ministry, advocating for more supports in the form of isolation, because it's sometimes challenging to isolate people in certain circumstances. So that's some of the work going on. Dr. Wang, do you want to add to that?
Yeah. So thanks for the question, Kate. So this is not unexpected, right? With the community spread, we expect to see cases in all population groups. We've actually been doing a lot of testing through the partners, a lot of testing of this population, and we are finding some cases, but so far it's less than 1% of those tested. So it's still a relatively low percentage. That doesn't mean that it can't be more people that we find. We actually expect to find more people as we test more, but I think it just really speaks to a couple of things. One, there's community spread, so we can expect this. Two, as Bruce mentioned, the partners have been working really hard on ensuring not only good infection prevention and control measures, you know, in the environments that these groups may be visiting to receive services, but also in terms of the supports to provide for people who are infected, you know, isolation spaces, and more support for their needs while they're in isolation. So that's, you know, what health system partners are working together on, and what Bruce is advocating to the province for further support on. So, you know, there's been a lot of work and a lot of excellent collaboration behind the scenes to try to prevent, you know, further spread. So to limit it as much as we can, and you know, so far it appears the efforts have been paying off quite well, relatively speaking. Right? We know there's people infected, but there could have been a lot more without those efforts.
Kate, do you have a supplemental?
My next one actually is for you, Chair Redman, and I'm just wondering, going forward, I mean, in the coming year, I know that the region just passed their budget, but what does it look like for you when it comes to advocating to the province and the federal government for more money? Like, what are you anticipating the region will get over the next few months? And do you think you're going to have to fight for some more money?
So I don't think I would depict it as fight, Kate. I would have to say that it will be advocating for large projects. One of the things that we're fairly confident of is that both the province and the federal government will be interested in investing in infrastructure. And I think it's really important to underscore that even during this pandemic, the staff at Waterloo Region have continued with large programs, large infrastructure projects, so that we will have shovel-ready, shovel-worthy projects if more money comes through the investing in infrastructure. The IKIP is the acronym, and I'm not remembering what it stands for right now, but it's money from both the provincial and federal government, so that we will be in a position that we can take advantage of it. I mean, one of the big projects is the second phase of the LRT going into Cambridge. We continue to do all of the due process that we need to make sure that when and if money becomes available, that we will be ready to apply for that in a timely manner. So I couldn't put a dollar figure on. I would just tell you that to date, the federal and provincial government have been honest partners and great supports. Even looking at the voluntary isolation money, we got $4.1 million about 3 weeks ago from the federal government. So they're recognizing that there is local need. We continue to do the due diligence so that we can identify those things and advocate on behalf of the region and our 630,000 residents to other levels of government. And I am confident that when and if money becomes available, we can make a very cogent case for why this is a great place to invest. Any further questions? Nicole, go ahead.
This question's for Dr. Wang. You know, obviously, the provincial medical officer of health felt Southwestern Ontario wasn't ready yet to have their students go back to school. I'm just wondering, from your viewpoint, can you give a benchmark to parents in terms of how many cases would we have to be at, or what level do we have to be at in the second wave in order for you to feel comfortable for students to go back to in-class learning here in Waterloo Region?
Thanks for the question, Nicole. So what we've seen in terms of the decisions that have been made by the provincial government about where schools can return to in-person learning, we've seen that all the areas have been areas with case rates below 40 per 100,000 per week. So I think, we can expect that this is likely what the province is looking for in terms of case rates. I am expecting that we'll have medical officers of health will have more information on what they may be looking for more specifically, but I do know that that's what's been common across those areas, and it's I think it's important to note that our case rates have gone down, have started to go down, so that's a good sign. They're still high, and for the time being, what we need to focus on in terms of getting them down as soon as we can is really just adhering to the provincial requirements for the shutdown and our own individual actions. And we will see week by week. I also heard yesterday that they will be assessing this week by week. So we'll be looking at this week by week as well.
Thank you. Anybody with another question? Looks good. Okay. Thank you all. Kate, you're okay. Thank you very much. Again, our trusted media partners, we really appreciate the opportunity to share this information with you. Tony, thank you so much for being here to round out the perspective of the economic conditions and the supports for businesses within Waterloo Region. Thank you all. Stay well. Have a great weekend, and no doubt we will talk